We will first hold the diamond strip on each end with our index and thumb, starting from the top of the contact and gradually proceed in a sawing motion from top to the gingival. Once that one side has a nice, good, open, smooth motion contact, we will then flip the diamond strip and proceed with the next side. Now, once it's all cleared and you feel a good, comfortable amount of motion, then slide the 0.1 millimeter gauge and measure to see if the amount of IPR was done correctly. Do not force the IPR gauge in that contact because you can always move teeth easily if you force an IPR gauge in. 0.2 millimeters of IPR. We would need a single-sided diamond disc and a 0.2 millimeter IPR gauge. We would make sure the lips and tongue are all pulled back, IPR from top, from the incisal to the gingival, and when we're done with the IPR, we can always check to make sure the contact is complete by pushing onto the gums to blanch the gums. We will then check it with floss to make sure that the contact is fully open, then measure it with the IPR gauge of 0.2 millimeters. Again, do not force the IPR gauge in. 0.2 millimeters of IPR using the upper coated diamond disc for the posterior teeth. If you were to slide the mandrel in close to the handpiece, as you see here, the handpiece will interfere with the anterior teeth as you do the IPR. We will now need to adjust the mandrel out further to avoid the handpiece from hitting the teeth. Again, we will proceed with going from incisal to gingival, cutting all the way through to the contact, and once we're done, we can always check to see if we completed the contact by pressing onto the gums just so slightly. Once we're done with the diamond disc, we would proceed with checking the contact with floss to make sure there's complete open contact. We would then check the contact with the IPR gauge of 0.2 millimeters to make sure that it was done properly. We will now show you how to do IPR of 0.3 millimeters using the double-sided diamond disc and a 0.3 millimeter IPR gauge. We would start with the incisal facial of the contact in the posterior, then gradually move over into the lingual and finish the contact towards the gingival. Notice we are using the pinky to help guide us or control the handpiece as we're cutting. Once we get a full open contact, we can double check it by stopping the handpiece and then pressing down on the gums. We will then proceed with measuring the space with a 0.3 millimeter IPR gauge, and because this contact is a little bit more broad, you will need to make sure to insert it in a proper path. Just forcing it in will not work. It has to be adjusted just so slightly, as you can see. Here at ClearCorrect, we do provide an IPR kit that has everything you need to perform IPR. In addition to the items we've covered already, there are a few other items in the kit you probably won't use as much, but they're still useful tools to have. We've already talked about the medium diamond strips, which will be used for hand stripping, but we've also included the fine and extra fine strips to smooth and polish teeth after contact reduction. We have added several diamond burrs to the kit. There is mosquito burrs and needle burrs. Both of those can be used for recontouring and even some IPR. We don't recommend using them for the actual contact reduction because of the uncontrolled amount of space that it creates, but it is great for reshaping the tooth after the contacts have been flattened by the diamond disc. The IPR kit is available at store.com.